Hello, my name is Alvin Tyson, and today we're going to talk a little bit about malaria. Our agenda for today will start with an introduction, conditions, symptoms and signs, treatments, tests, and diagnostics, risk factors, most current and recent outbreaks, vaccinations and complications, preventions, and we'll play a little game called Transmissible Trivia. First of all, we're going to talk what is malaria? Well, malaria is one of the most prevalent parasitic diseases worldwide, especially in tropical and subtropical regions. Malaria remains a global health challenge, particularly in sub Saharan Africa, Southeast Asia, and South America, where it causes significant morbidity and mortality. It is caused by the protozoan parasites transmitted through bites of infected female Anopheles mosquitoes. The cause is Plasmodium infection. Malaria is caused by a parasitic protozoa of the genus Plasmodium. There are five species of the Plasmodium that can infect humans. I'm not even going to try and pronounce those, but there they are. First, we're going to talk about Plasmodium is a protozoan parasite, and it exists in different stages with various shapes and sizes. The Plasmodium does not fit in the typical gram-positive or gram-negative classification, which is specific to bacteria. Plasmodium is classified as a parasitic infection. By definition, it's an illness caused by a parasite, which is an organism that lives inside another organism and benefits from the host's expense. Parasites can either be single-celled organisms, multi-celled organisms, or ectoparasites like lice and ticks. Conditions. What does malaria need to survive? Well, it needs an optimal environment. Plasmodium parasites rely on human hosts for their survival and reproduction. Their nutritional needs includes red blood cells from the host, which they can consume and grow and reproduce. The optimal environment for the parasite's life cycle is the human bloodstream and liver, where it completes different stages of development. Their modes of transmission are through the bite of an infected Anopheles mosquito. The mosquitoes become infected when it feeds on the blood of an infected human. The Plasmodium parasite is passed to the human during the mosquito's next blood meal. Malaria's most affected areas are primarily affects people living in tropical and subtropical regions, children under 5, and travelers to endemic areas are especially vulnerable. Native pregnant women and those who travel to areas where malaria is an epidemic. Most areas include the sub-Saharan Africa, Southeast Asia, South America, and parts of the Middle East. Signs and symptoms. How do you know that you have malaria? Well, the symptoms of malaria usually appear within 9 to 14 days and are as follows: fever, chills, sweats, headache, fatigue, muscle aches, nausea, vomiting, anemia, and jaundice. Now, this is pretty common, so how can you differentiate malaria from other diseases? Because all of them start out with fever, chills, sweats, headaches. But, it goes on. There are tests that you can take to prove it. They've got severe symptoms where it could cause problems in the brain, kidney function, respiratory distress, and even organ failure. The body systems that are affected is the liver, the bloodstream, the brain, and the kidneys. Diagnosis, test, and treatment. How is malaria tested, diagnosed, and treated? Well, they did have a vaccine, but it wasn't very popular. Microscopic examination of blood smears, rapid diagnostic tests, and polymerase chain reaction tests to confirm and detect the levels of malaria. Malaria treatments are the artemisinin-based combination therapies, chloroquine, quinine, mefloquine, and Von Adavaquan. Yeah, okay. So risk factors. Most current recent outbreaks. So there was an outbreak in Texas, I believe. Living and travel in endemic areas, lack of access to health care, children under 5, and immunocompromised individuals. And recent travel to areas where malaria outbreaks have occurred. The most recents were in Florida, and those were 6 cases. And then in Texas, vaccination and complications. They've got the RSTS, first malaria vaccine approved by the World Health Organization for use in young children. Research ongoing effects are focused on developing more effective malaria vaccine. Complication with malaria. So if it goes untreated, you can cause cerebral malaria, acute respiratory distress syndrome, severe anemia, organ failure, or even death. Prevention of malaria. Is malaria preventable? Yes. And finally, transmissible trivia. Malaria is caused by bacterium, true or false? The Plasmodium parasite is transmitted by the Aphids mosquito, true or false? The primary treatment for malaria is antibiotics, and there's a highly effective malaria vaccine widely used around the globe. Children under 5 are at higher risk for severe malaria. And your answers are false, true, false, false, true. Thank you. This has been my presentation. Good night.